My name is Rachel Henderson. I'm a nurse practitioner. I am the clinical director and co-owner with Carol of the Utah Joy Wellness Partners location. So I am dual certified as a nurse practitioner in both acute care and family practice. I have been a nurse practitioner now for almost 12 years. I have practiced in all areas of the hospital and now practice outpatient in the regenerative wellness setting. And I love the Stellate block and with lots of patients, but also for myself and for my family. I look forward to being able to have this conversation and talk about the block. So we're going to start. A lot of people have a question about the stellate ganglion block. Like, what is it? What are we talking about? And so we're just going to talk about it and break it up. So stellate is derived from the Latin word stella, meaning star-shaped. It is the name of a nerve that is part of your sympathetic nervous system. Ganglion is a cluster of nerve cell bodies located outside the central nervous system. It resembles loosely wound rope fibers if you were to kind of look at it. And then a block is a medical procedure that temporarily interrupts nerve signals, typically using local anesthetic or medication. So when we look at what a stellate ganglion block is, it is a medical procedure in which local anesthetic is injected near the stellate ganglion, a star-shaped cluster of nerve cells in the central or sympathetic nervous system located at the base of the neck. So everyone's like, okay, well, great. You just gave me a very medical definition for this procedure. I still am not quite sure, and we're going to go into that. As we talk about it, you might see it called an SGB on our slides and as we talk, but all the same thing. So the historical background is the stellate ganglion block has its origins in the early 20th century medicine, where physicians began exploring the role of the autonomic nervous system in pain management and vascular conditions. The first documented use of a sympathetic nerve block was in 1925 by German surgeon Frederick Kappes, who was using it to treat circulation disorders. And then it came to the US in the 1940s, where it was used primarily for chronic regional pain syndrome and angina, and has grown from there. And we're going to talk about some of those indications. But once again, let's talk a little bit about where is this nerve at. So as we look at the human anatomy, you can see this is our neck here, and you can see that we've got our different muscles. You have your collarbone. Under all of these is your spine. This is the C6 vertebral body here. So the left stellate ganglion, you do have one on both sides, runs around the side of the neck. And you have one on both sides. They both innervate half of your body. We are very linear, not linear, sorry. We have sides of our bodies in that way. And so that is where the stellate ganglion is at. So in order to understand a little bit more about what the stellate block does, you'll see when we talked about the autonomic nervous system, when we talk about the sympathetic nervous system. So let's talk a little bit more about that so you have an understanding of how this works. So the autonomic nervous system is the part of your nervous system that just automatically does stuff. Like, this is the stuff that kind of runs in the background of your mind. You don't have to think about it. It's just involuntary bodily function that keeps you alive every day. So this is our heart rate, blood pressure, digestion, temperature control, things like that. But in our autonomic nervous system, there are two different sides. We have our sympathetic nervous system, or the sympathetic side, which most people remember is our fight or flight. This is what activates our stress response. So this is what increases your heart rate and blood pressure and redirects energy to helping you stay alive. But the other side is our parasympathetic side. And this side sometimes is forgotten or overlooked. This is the rest or digest side, but I also try to teach my patients to think of it as your feed and breathe, and also your recover and regenerate. because those are kind of the functions that happen in this setting. And so it promotes relaxation, slows heart rate, digestion, and recovery. Now you're going to see that these are both very distinct systems. And when I talk to my patients, I'm like, you want to think of these as like they're on a balanced scale or perhaps a teeter-totter. When one side goes down or when one side goes in overdrive and goes up, the other side has to go down. You can't have both of them go up. They have to give way to each other. Ideally, they work in harmony together, and you're like how the scale is now, where it's balanced. And maybe you have a little bit of a stress going on and it goes up a little bit. And so your sympathetic goes in overdrive, and your parasympathetic kind of gives way to that. But hopefully that's a short-lived response and you go back into better harmony. And it's easy to move between these two parts of your autonomic nervous system. But unfortunately, with a lot of individuals, and especially in our modern living, we get stuck in primarily a sympathetic overdrive, right? And that can be due to a number of different reasons. It can be due to trauma. It can be due to stress. It can be anxiety, depression. I always tell my patients, like, I have 3 small children that I absolutely love and adore, but I'm trying to raise to be productive members of society. And as my body recognizes that as stress, and it doesn't think that my children are trying to kill me, but it gives that same response, right? It's thinking, oh, this is a stressful thing. Something bad is happening. We need to move into this kind of more stress response, that sympathetic state. And if I'm not careful, it's harder. I just kind of build and build up and build in my sympathetic side. And it makes it harder to give way to my parasympathetic side, which is my resting side, my recovery side, and just letting my body kind of just let go and have that peace for the moment. And so that's really where the power of this stellate block comes in, is helping to restore that balance between these two vital, and you need both vital parts of our autonomic nervous system. So let's look at some indications. So for pain syndromes, like I mentioned, it first came to the US for chronic regional pain syndrome in the early 20th century. But currently it's still used for the complex regional pain syndrome, post-herpetic neuralgia, phantom limb pain, cervicogenic headaches and migraines, trigeminal neuralgia, brachial plexus injury, and shoulder hand syndrome. For vascular disorders, Raynaud syndrome and phenomenon, we've had good success with that here in our clinic. Frostbite and peripheral ischemia. We're going to talk about why these indications work individually, but scleroderma, digital ulcers, refractory angina, sympathetic mediated coronary vasospasm, right? Looking at that. And then on the mental health side, we have the post-traumatic stress disorder, and that's PTSD, and that's complex or just the regular, or not regular, but the non-complex, anxiety and panic disorders, depression, post-concussion syndrome, and traumatic brain injury. Some of the emerging indications that we're getting new research on is long COVID symptoms, chronic fatigue syndrome, fibromyalgias, hypohidrosis, anosmia, and which is loss of smell and loss of taste, are different things that are coming and helping to balance, that are benefits of balancing this autonomic nervous system, that sympathetic and parasympathetic state. So as we look at how that works, we'll hit contraindications real quick. Sorry. There are really just a couple contraindications. There's absolute, which would be an infection at the site of injection, right? If we're going to do this injection in the neck and we look and you have a raging kind of cellulitis in that area, we're not going to be able to do it. Or if you have severe coagulopathy, and that's severe, right? These are big time issues. This isn't if you are on a blood thinner post procedure, if you've had a device, if you've had an MI, or you've had a blood clot, that's not what we're talking about. We're talking about severe coagulopathy risks. And then the relative risks or relative contraindications our uncontrolled hypertension. Once again, these are people, not that you have it and you're good when you're on your medications, but these are people who have really high uncontrolled, and we will screen for this before we do our procedures. Also, if you have some type of anatomical anomalies, that when we do the ultrasound, we look and it's like, wow, you have these blood vessels that are in the way. We won't be able to safely get to it, or you have something that we weren't expecting that we found on, then that would be a contraindication. But as you can see, it's a very small list. And so that's one of the great benefits of the Stellate block, is that it can benefit a lot of people, and there's very few criteria that eliminate anyone from being a good candidate. So as we look at how the Stellate block helps in those different indications, the four main things that it does is that it dampens hyperactive sympathetic tone. So it dampens that overactive fight or flight response. The other one is it improves sleep and emotional regulation. It's going to enhance neuroplasticity and recovery. And then it's going to regulate the amygdala and fear response. So now we're going to look at each of these and see how it works. So dampening the hyperactive sympathetic tone. So with PTSD and anxiety disorders, they're associated with chronic sympathetic overactivation, leading to heightened stress response, hypervigilance, and an exaggerated startle reflex. These are my patients who come to me and they're like, I am just always waiting for the next bad thing to happen. Like, I just know something is coming. These are my military, either veterans or active duty, who come off and they are just on high alert all the time. Or my first responders who, even when they're off shift, are waiting for the pager to go off that something bad is coming. They just have that state of hypervigilance and heightened or exaggerated startle reflex. And so by blocking the stellate ganglion with the block, it reduces the release of norepinephrine, which is a stress-related neurotransmitter, which in turn decreases the physiological hyperarousal, right? And so you were just kind of turning that down, which is so awesome. And so then with improving sleep and emotional regulation, when you have, once again, that sympathetic overdrive, that hyper vigilance, all those things, it disrupts your sleep cycles, contributing to insomnia and poor emotional regulation. And how this happens, like I said, we have a balanced scale. And so your parasympathetic side, your nervous system, that part of it is where you sleep. And if your body is so entrenched and so overdrive on your sympathetic side that your body's like, nope, we aren't safe. I need to protect this person. I need to do these things. Like, it will not let you go into that good parasympathetic side. And so patients who talk to me about waking up in the middle of the night with just their brain going, or not being able to settle down, or having a startle reflex when they're trying to fall asleep, those are signs of your body not having a good sympathetic parasympathetic balance. Your sympathetic side is like, nope, I am going to drive this train. I know what's best. I'm going to try and keep this person safe. And something I failed to mention is this balance of sympathetic, parasympathetic, fight or flight versus rest and digest. This balance goes all the way down even on our cellular level. If we are allowing our cells to rest, or if they always feel like they're under attack from inflammation, stress, toxicity, other things, then they won't gain out those old cells, and we won't regenerate, and we won't produce all of the things that we need to have a better life. Okay. So for sleep, though, the stellate block has been shown to normalize autonomic function, giving that better balance. So it's leading to better sleep quality, reduced nightmares, and improved mood stability. I can say I definitely see this. I am the first to admit I've had the stellate block done. I've had it done a number of times. And I can always tell when my sympathetic system is getting in overdrive when my sleep is interrupted. I will wake up and I'll start thinking about, what do I need to do for this patient? What in the middle of the night? Like, I kind of get woken up, and instead of just rolling over and going back to sleep, it's like, I need to plan this next thing. I need to work on this for this patient, right? Because my sympathetic nervous system is revving, trying to override my parasympathetic. But when I get a block, it's like I just notice all of a sudden I am just sleeping so much sounder. And my body, my parasympathetic side is able to just really come in strong and go in that not hyper overdrive, but become the dominant driver, and just allows me to rest so much better. So enhancing neuroplasticity and recovery. Research suggests that by reducing chronic stress signaling, those neurotransmitters, like we talked about with the norepinephrine, the SGB may promote neuroplasticity, allowing the brain to rewire and form healthier emotional responses, right? We turn that signal off and our brain's like, hey, let's redo these pathways. Let's grow new pathways to help with these responses. So some studies are indicating that the effects of the SGB persist for weeks to months, offering long-term relief, right? Helping better recovery because it's just rewiring that pathway for us, which is super cool. So regulating the amygdala and fear response. The amygdala is our key brain region in fear processing and becomes hyperactive once again in PTSD and anxiety. It just works in overdrive. So by inhibiting that excess sympathetic outflow, once again, getting that teeter-totter or that scale back in balance, it reduces, this SGB reduces amygdala overactivity, leading to a calmer emotional state and improved resilience to stress, which is so neat. So by interrupting the feedback loop of chronic stress and hyperarousal, the SGB provides a physiological reset, allowing individuals to regain emotional balance and improve their overall mental health. When I talk to my patients about those resets, the analogy I like to use is any type of smart device. So your computer, your iPad, your tablet, your phone, we are really good at opening a lot of applications and programs and having many things run, right? But all that does is it slows down our operating systems and makes our phones or whatever not work as well because they're trying to keep all of these background things going at the same time. And sometimes our phones just are like, nope, I'm done, I'm not working anymore. And so what we have to do is we have to close all of those apps. And we have to sometimes just do a hard reset, right? Just turn the phone off or the computer or the tablet, turn it off and let it reset. And that's similar to what the block does, is it's like you've got so many signals going that it is hard to get it to set. One of the things I am now realizing I should have kind of put in here is one of the best ways to make the stellate block the most impactful is pairing it with some type of counseling or therapy. Because the stellate block is a wonderful physical procedure that is going to help balance the autonomic nervous system. But if you have all these stressors from PTSD or anxiety or stress in general, if you have these triggers that you are not dealing with or processing or helping to work through, then it's not going to help in the long run, right? This is the physical side of helping treat anxiety and stress, and the therapy and counseling side of that is helping with the emotional or spiritual or intellectual side of what goes into that. And for my patients, I've seen
then how was it
with doing both.
Oh, okay.
Yeah. Right. And so,
sure.
Yeah.
All the round table or yeah.
So we'll talk about the procedure. Just as a reminder, if you have your microphone on, if you don't mind just muting it if you're having side conversations so that we're not distracting other stuff that's going on. So this is a patient getting ready to have this procedure. So what you do is you come into the clinic. We do a couple of phone calls prior, or you can come into the clinic and do them in person prior to the procedure, where we just talk about the procedure. We talk about, you have, in Utah, you have those phone conversations with either myself or one of the other nurse practitioners in the clinic. In our San Diego location, they have providers there who you will talk to. and they'll just run you through. We talk about how the procedure goes. We talk about how to come to the procedure. We want you to have, we want you to be prepped and ask any questions that you have. We make sure you don't meet those contraindications, right? Do you have a severe coagulopathy? Do you have issues with bleeding? Or how is your blood pressure? Do you have an infection in this area? Like, we just try to get that all out. We try to figure that all out before you come. When you come to the procedure, when you come to the clinic, we have you come in, you get checked into the clinic. We check your vital signs, make sure everything's okay. We do place a peripheral IV for safety precautions, and we'll talk about why that is in a minute. And then we come in and we do diagnostic ultrasound on your neck. So we do all of our stellate blocks with ultrasound guidance. There are some clinics out there who will do them under fluoroscopy, which is a different kind of imaging guidance, but I do believe it is standard of care to do them under image. I have heard of some places just doing them blind and doing it off of anatomical, knowing the anatomy, and I just don't think that's very safe. And so, especially with the convenience and accuracy of ultrasound guidance. But so you lay down flat on the table as you see this patient is, we have you turn your head to the side, and then we do the ultrasound guidance. And so this patient has had her guidance done. We've charted the path. What we're looking for is those anatomical anomalies. Do you have something going on? Where is going to be the best place where we can go in and get the stellate block? We are actually not trying to actually hit the nerve itself, because that would not be very fun for the patient. We're trying to get it into what we call a plane, one of the fascial planes where the nerves actually run. Because like I said, it's a loosely wound rope. And so there's a bundle of nerves. And so it's not just one. And so we want to hit this little fascial plane, and we're going to create kind of like an aqueduct there and open it up. So we bathe the entire ganglion, because with those fascial planes, that's what they do. They're really cool that way. If you can hit it, then it will spread and bathe the entire nerve without actually having to touch it. We are trying to avoid blood vessels because we do not want to get into those. And like I said, we'll talk about what happens if that is. But so we go in, the actual needle in the neck part of the procedure is about 60 seconds. It's not very long. And then you are being monitored. And then after that, the needle comes out, and we are then monitoring you. We want you to lay flat for 10 minutes after the procedure. And that has to do with the fact that, once again, it's a liquid. It's in this area of your neck. It's not a tight, closed area. If you were to sit up, gravity would pull that liquid down, and you would hit a lot of what we call nuisance or these structures, and they give what I call nuisance side effects. They are not permanent. It is not harmful. They are just kind of uncomfortable and a nuisance. And like I said, we're going to talk about those in a minute. And then after that 10 minutes, after you've been monitored, everything looks good, then you're able to go and you're able to get up. And we do ask that you have a driver drive you home for safety precautions, because you might some patients do feel a little tipsy. They feel like comments are that you feel a little drunk, a little off balance. And so we just wanted to make sure you're safe while you're on your way home. So things that you can expect to have happen after the block. The things that we are looking for is something called a Horner sign. And so this is actually me after my first block. This was the picture on the left is my block right after I got it immediately. And then the picture on the right was a couple hours later. And so you can see that I have that drooping eye. It's kind of hard to see because it's not very good picture, but my pupils are not equal. So that's a Horner syndrome. That's what we want to see. We want to see a change in the eyes on the affected side. So that same side. Other things that lets us know that we got a really good. Other symptoms or other things that we expect to see is people will talk about nasal congestion. They feel like they have, all of a sudden they felt like they could breathe well before, and now they're like, oh, I just feel like I'm super congested. one of the benefits of why the stellate block works so well is it is a potent vasodilator. It's going to open up the blood vessels on that side of the body where we did your block. And so those little turbinates are so small. So when we dilate them, those blood vessels, it can kind of feel like congestion. You'll also, because you have had those blood vessels dilated on side, you might feel flushed or warm on that side. I have also had patients where you could physically see that their skin color gets darker and more ruddy and red on the side where we did their block, which is always super cool because then you can see that, what's going on. I always jokingly tell people, I'm like, it's not permanent, right? People joke and they're like, oh, you have the stroke face. And it's like, yeah, it kind of looks like a stroke, but it's definitely not permanent. It's kind of what we expect to see. I always joke, I'm like, yeah, look at me, I'm back to normal. But yes, this is kind of what you will see with that. Other things that you might experience as far as like risks or complications is we're going to talk a little bit more about these like nuisance side effects. So common ones have to deal more. Like I said, the Horner syndrome, people like to say it's a risk or a complication. I don't really like to put it there, but I ended it on this slide, but because we want to see that happen. I want to see the change in your eyes to know that we got a good block. But there are other things that can happen that are just variable person to person and even block to block because of, like I said, it's a liquid medication that we're using. We are using ropivacaine, by the way. It's part of the lidocaine family. We choose that one because it's a little less irritating to the cells, and it will convert, I think it metabolizes down into B12 if I'm remembering correctly, but also it's half-life. Then it will be completely metabolized in 6 hours. So as we look at these, sometimes of these nuisance side effects, when people are like, how long is this going to last? We're looking at about 6 hours until that medication, because once that medication is totally metabolized out of your symptoms, these nuisance side effects will go away. So let's talk about these. Temporary hoarseness. If some of that medication kind of leaks down and hits your laryngeal nerve, you will feel like you lose your voice. And I tell my patients, I'm like, oh, if you lose your voice, just let it be gone. It's not like you're sick. It'll come back. Just whisper, be mysterious and just whisper for a couple hours. Other ones that can happen, it can go down and it can hit your phrenic nerve and people will feel like they can't take a big, deep breath. It's only on one side. You will do okay. We monitor patients. We help remind them like your oxygen saturations are still good. It just feels weird because your body is used to breathing with both sides. Other times we'll have it come down and maybe people will say like my whole ear is numb. You might feel your shoulder go numb just because once again, it's not a tight space that we're trying to put it in there. And with a liquid medication, it can spread and just other things. Doesn't mean your block wasn't beneficial. It doesn't mean you're not going to get the great benefits. It's just, like I said, a nuisance side effect. And so I try to prep all my patients. I'm like, this might happen. Just remember, you're doing this block not for this immediate procedure, but we're looking at how this is going to affect your life going forward. I tell my patients, don't make a judgment on whether or not you think this block worked and for about 60 days, because sometimes the changes can be subtle. And so you want to be open to those. Other things, some of these other nuisance side effects are feeling like you have something stuck in your throat. It's like, oh, I've got a glob in my throat. I can't swallow. You can still swallow, just you have to mentally think about it. It's just kind of one of those things. So these rare but serious side effects, once again, I always put these out here, knock on wood, touch wood, we've never had this complication because we are doing everything with image guidance and we're following all the safety protocols. But an intravascular injection, this is why I said we are looking for blood vessels. Because if we were to put ropivacaine straight into your blood vessel and inject it, it would cause seizures and could cause a cardiac event. We could put your heart into an arrhythmia. We could stop your heart altogether. That is why we do that peripheral IV. because we do have the reversal agent. Like I said, touch wood, knock on wood, whatever. We've never had to use it, but we still put that safety precaution in there because we want to make sure that we are doing everything to keep our patient safety top of the mind. Technically, you could get a pneumothorax. I do kind of laugh at this one. I'm like, I don't know where people are sending that needle to because of where you are injecting. If you were using image guiding, you should see you are nowhere close to the lungs. But technically, yes, if you were being kind of squirrely, you could hit somebody's lung. And pneumothorax is when you get air around their lung. Infection, anytime you are puncturing the skin, you always run risk of infection. This just comes, right, because our skin is our first line of like topical and our defense for that.
Rainbow?
Once again, spinal cord injuries. Once again, you would have to be doing some pretty interesting stellate blocks, in my opinion, without image guidance, to be able to get into the spinal cord. And so we've never had any of these injuries. And so, but I always try to educate my patients. I'm like, these are the things, but we should be fine with that. We shouldn't have to worry about them. So I want to talk a little bit about a couple case studies. And I'm going to talk about them like they are specific patients. I can tell you generalities about them, but obviously I can't use their names or anything. But some of the patients that I want to share about, I want to talk about, I have a husband and wife duo that came and got the stellate block. And the wife, when she learned about it, was all in. She's like, this is going to be great. I love this. And they are both this couple. They are both in their 50s. They have been married together for over 20 years, but they are on their second marriage. And they had shared with me that they had kind of traumatic childhoods. They'd done a lot of self-therapy, a lot of work along the way. And so when she learned about the stellate block being that last piece that hopefully could allow her body to move out of that hypervigilant state, she was all in. And so she said to her husband, hey, we're getting these. And he was like, okay. He had no idea what it was. And he was like, hey, whatever, my wife's a trier, I will try this. And so they both got the stellate block, and she noticed stuff right away. She was just like, this has just made such a big difference in my life. And he was very much quiet about it. And they are my good patients, and they continue to get treatments. And about 6 months after his block, or 4 months after his block, his wife, like I said something to his wife, I was like, hey, how is he doing? He hasn't said anything about this block. And she's like, I have noticed such a big difference. And so I actually, the next time I saw him, I called him out on it. I was like, hey, your wife had mentioned that this is happening and you're having these benefits from the block. And he was like, I was so skeptical at first, but yes, he's like, I feel like my response, he's like, I was always stuck in fight with my adult children, with my wife. He's like, if somebody came at me or if there's something that frustrated me, my first response was always fight. And he's like, and it didn't matter how big of a, in my mind, infraction it was. I was always giving a big fight response because I was so frustrated. And he's like, and I was so in overdrive. He's like, but now I feel like I can give the right type of response. And so if this is what's happened, it's like, hey, don't do that again instead of blowing up. And then in talking to them together, the wife mentioned, she's like, he was in fight. I was always stuck in flight. And so when conflict would come up, she's like, I would run away and he would come at me full steam. He's like, and we just never were able to talk about some of these hard conversations that we needed to. And not that it was hurting our marriage or anything, but it just kind of held us back. And since they both got their block, they said, it is just awesome to see what kind of conversations we've been able to have, because that response has been able to, has come down, and we're able to not feel so much of that sympathetic overdrive. They can just, because they're not in danger, they're not right and now stressful anymore. I love that for them. I think that's great. The next one that I have is actually a young man who is 31, and he actually came to me with erectile dysfunction. And he had come to me, he had seen other providers, and he was just like, hey, I know you do sexual wellness. What you got? And I shared with him, I was like, I'm not just your typical ED clinic. I approach ED in a lot of different ways. And one of my favorite ways to treat it is actually with a stellate block. And he was like, what are you talking about? And I was like, well, right, when you are in stress and you have high anxiety about things, you're not able to get into that parasympathetic side. And that is your sex side. All of our arousal, all of our like getting into the mood, that is all parasympathetic driven. You have to overcome that stress and high anxiety of your sympathetic side to get there. The actual orgasm for both men and women is a sympathetic response, but everything that leads up to it is parasympathetic. And so we talked about it, and it was like, I think this is interesting. And I was like, hey, we're going to add some other stuff as well. But we did the stellate block, and he did notice that he had improvement in his erections. And I said, just think about it. We joke a lot about having the stress of performance anxiety. And I said, this just helps to kind of bring that down. And so that you are able to get more into that parasympathetic state. And he's had really great, he did have really great benefits from it. Like it's not the only, like I said, it's not the only thing we did, but it definitely made a difference to add that to his treatment regimen. The other case study that I want to highlight is for a young girl who she was 22 when she came to my clinic, and she came specifically for the stellate block. And she had a lot of heart issues as a young child and had to go through a lot of medical procedures to help her heart. And at the time, she felt like she was just like, she never like really shared what her incident was, but she did feel like there was a couple of things that happened that she lost trust with the medical system. And she was always just kind of waiting to worry about when she was going to have issues with her heart again, because she didn't trust being able to go back to doctors. They had hurt her trust, which I very much, being a medical provider and feeling like we aren't trusted, that really made me feel bad for her, and that she was treated that way. And so she chose to get the block to try and help just let go of that, because she worked through therapy, and she's like, I know like that is what happened before, but I'm just holding on to it. And so she got a block, and she actually right after was able to just feel so much peace. And one of the coolest things that she said to us was that she just took some like really big deep breaths. She's like, I just feel like I can breathe for the first time. She's like, I just feel like I can just let go. And so that to me, those are the reasons why I love the block so much. And like I said, I've seen it in my own life. I've seen it in my family's life. I do think that it is such a great thing to put in and help patients with this sympathetic, parasympathetic dysfunction, autonomic dysfunction, to help bring balance back, to help balance these type of things. And so in closing, I do want to put a little shout out that April is Mental Health Awareness Month. And so at Joy Wellness Partners in the month of April, we will be providing stellate blocks at a discount for first-time patients, for patients who are getting the stellate block for the first time. You can be a wonderful established patient at Joy Wellness Partner and still take advantage of this, but these are for patients who this will be their first time stellate block. But if you have questions, please reach out. The Utah location and phone number is on there. You can also reach anybody in the San Diego office at info@Joy Wellness Partners. Follow our social media feeds. But also, if you visit our website, you can book complimentary 15-minute phone calls with providers at either location, just to talk more about the stellate and whether or not. With that being said, thanks for tuning in, and let us know if you have any questions in the future. Thanks.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.